Welcome, and thank you for joining our company today to listen to some insights on the impact of COVID-19 in different levels of our lives. We will discuss things on individual, institutional, and societal level. Feel free to go to menti.com and use the code to enter our online flyer. Speaking of coding, we focus on coding and bridging as well, and we have combined different backgrounds to this project, and we're the biggest group of this course, having members in theology, medicine, management, cardiovascular, and biomedical research. We all share in common that we have a passion for COVID-19 research and combine our knowledge to make a framework for future interdisciplinary research teams like ours. The socio-ecological framework was developed for bridging any layers on the micro, macro, and meso level. We want to enhance, within the context of a pandemic, the societal, institutional, and individual aspects, of course. And as our audience, you're maybe also wondering how these topics influence your personal mental strategies. So we will focus on the individual level, as well as psychological well-being, which is also a hot topic under hospital staff, on the institutional level, and also the general public on societal level. The details of the Dutch pandemic are summarized in our online Menti environment, so use the code above. But first, let's start with the overview of the societal level by Maaike.
At the level of societies, COVID-19 mainly had its impact due to the restrictive measures that were taken to prevent its spread, rather than the disease itself. We mainly looked at the implications for overall mental health and ideas about vaccination. In our literature research, we found that the number of daily COVID-19 cases in the US accurately followed the odds for getting anxiety or depressive symptoms. We also noted that mental health is extensively intertwined with other domains, such as physical health and occupation. Indeed, the increase in unemployment rates and job insecurity during the COVID-19 pandemic has played a role in mental health issues. We also looked at vaccine hesitancy in different groups of the population. In diabetes type 2 patients in the Netherlands, vaccine willingness was high. However, in strict Calvinist religious groups, this was very low, as we will see in the individual part.
Furthermore, we examined on the individual level which impact COVID-19 has had on the well-being of people. We described the psychological harm which was reported for especially students and people having low socioeconomic status. We provide coping and recovery strategies as a way out. Religious people use sources and rituals to cope with the crisis. I myself have studied strict Calvinists and noticed that what binds them together was not only their sense of community, but also distrust in the government. The government tries to reach such strict religious groups to be more willing to take the vaccine, and especially strict Calvinists are known to be skeptical. We saw that feelings of distrust are softened when people either encounter the seriousness of COVID in their close proximity, or when a sense of malleability, namely the vaccine being portrayed as the way out, or that we will get it under control, is somewhat reduced. In that way, slightly altered government communication may actually improve vaccination willingness in such religious communities.
Leadership is forming networks and relationships, just as we did in the organization of hospitals and in the elements of this presentation. When we go back in time to the beginning of the pandemic, Dutch hospitals did not only have little time to prepare new policies, in anticipation of the first peak, of course, but they also had little experience, let alone scientific evidence, to base those policies on. So, naturally, Dutch hospitals created their own policies based on limited experiences from foreign hospitals and the WHO guidelines. Our SWOT analysis of the Amsterdam UMC has shown that both COVID and non-COVID healthcare was organized, and they did a very good job in diagnostics of COVID patients. We did also investigate complications in the patients of this hospital. And interestingly, we saw that 18% of COVID patients had a heart issue in their medical records. And interestingly, 2% of patients had pulmonary blood clotting, as well as investigating the diagnostics in this institution, where we saw that lung ultrasounds were very more effective to get a very clear idea of the lung infection. But we never forget, of course, the PCR and the nose swabs that we all probably got at this point. So let's swap to the framework again. As we combine 7 projects on the topics of Calvinists, psychology of drug addicts with the KIND network, how students in Indonesia deal with the personal mental health, and how non-COVID research was organized, with the highlight being the national stop of plannable care in December 2020, and the cancellation of operations upscaling in the same period. We also investigated how diagnostics with lung ultrasound was conducted and have gathered knowledge on anxiety levels in society that arose with the amount of COVID numbers. Well, everything connects to each other, which gives us the opportunity to recommend interdisciplinary work, since it gave us the framework to investigate more aspects than we would have with only our individual thesis projects and backgrounds. Concluding with the statement of our interdisciplinary colleagues at the WHO, we need to learn the lessons that are being shown from this virus. Thank you very much for international colleagues as well, and for our audience for your attention.